afternoon. Welcome back to PWT Rely News with your host, Mosey Along. And today on Lest We Forget History, we're going to talk about Medicare Hospital Insurance Fund running out sooner than later. Medicare's Hospital Insurance Trust Fund, the part that pays for inpatient hospital care, skilled nursing, home health, and hospice, is now projected to run out even sooner than previously expected. According to the latest 2026 Medicare Trustees Report, the fund will be unable to pay full benefits starting in the second quarter of 2033, which is 3 months earlier than last year's projection. What's driving the shortfall? Several forces are pushing the fund toward depletion. Lower tax revenue due to recent federal tax cuts, including provisions in the, quote, big, beautiful bill, which reduced the taxes that normally flowed into Medicare. Rising healthcare costs, especially to hospital services, skillful nursing, home health, and hospice. Demographic pressure, more Americans aging into Medicare, while fewer workers are paying into the system. What happens in 2033? Congress does nothing. Medicare Part A will only be able to pay 89% of scheduled benefits once the trust fund is depleted. That means hospitals, skilled nursing facilities, and home health agencies would face immediate payment cuts. Something to look forward to in our golden age. Hey, partners? And seniors could feel the impact through reduced access or longer wait times. So instead of waiting in the hospital emergency room for 72 hours straight, you get to lie in the corridor on a hospital bed for 2 weeks. Has this happened before? No. Congress has never allowed the Hospital Insurance Trust Fund to become insolvent. But this is the 9th straight year the trustees have issued a formal Medicare funding warning requiring the press to submit legislation, a requirement that has gone ignored for more than a decade. What are our options? Lawmakers have several choices, none of them painless. Raise payroll taxes, reduce benefits, cut provider payments, restructure Medicare Advantage, or some combination of all three. Experts warn that the longer Congress waits, the more abrupt and painful the changes will be. Won't affect them. They get it for free. All the government and their families and their families. Why this matters to us retirees? Medicare covers 69 million Americans, and Part A is the backbone of hospital care. A shortfall doesn't mean Medicare disappears. Oh, no. But it does mean automatic cuts unless Congress acts. So, what do you think? Is it really going to happen? Or are all us going to go down the drain with Drano? Stay alert, stay awake, and get those letters going to the people who supposedly represent you in Congress and tell them, well, they're sitting pretty, you ain't. Have a great weekend. Stay cool, stay alert, and remember, call that congressman. Ciao, baby.